Hi, everyone. Welcome to today's webinar. I'll give everybody a couple of minutes to join. As you are filtering in, please introduce yourself in the chat box and feel free to share where you're tuning in from today. We have a very exciting town hall today about Center of Excellence program run by Cure HHT. I'll be your host, Valerie Machin, and I'm joined today by Tania Competiello, who works for the National Healthcare Programs team at Cure HHT as our Senior Director. Give everybody a couple minutes to file in. Also, happy HHT Awareness Month. We are halfway through the month, doing a lot of awareness raising. I'm seeing a lot of social media posts reminding everybody wear red on June 23rd. Take a picture, post it on social, and tag Cure HHT so that we can see everybody raising awareness in their own way. We will be getting started in just a couple of minutes. And I see we have some people joining from California, Washington, Texas, Virginia. Welcome, welcome. Thank you for joining us today. This is a great webinar to go over some of the updates that are happening to our Centers of Excellence program, both in the US and Canada, and some updates for international to come as well. I'm going to get started with some of our housekeeping slides. Again, my name is Valerie Machin. I serve as Cure HHT as Senior Manager of Brand Strategy and Content. Thank you for joining us today for a Town Hall Cure HHT Center of Excellence Programs updates, hosted by Tania Competiello, Senior Director of National Healthcare Programs at Cure HHT. Happy to first share our HHT Connect registry. This is the global HHT patient registry. HHT Connect gives patients around the world a secure way to share their health information so researchers and clinicians can better understand HHT. And ultimately, that research and data is what funds better treatments, drives better care, and one day leads to a cure. The registry is designed to be accessible from a desktop, laptop, tablet, or mobile device. You create a password protected account and then complete surveys at your own pace. This is one of the most meaningful ways patients can contribute to research without ever leaving your home. The more we understand the full experience of HHT, either living with it or caring for it, the stronger the case becomes for research, treatment development, and improved standards of care. You can learn more, sign up at curehht.org/HHT Connect registry at the URL below. We also encourage you to visit the Participate in Research page on the Cure HHT website periodically. I have included the URL in this slide as well. Throughout the year, Cure HHT shares opportunities for patients, caregivers, and families to get involved in studies that help move research forward. Some opportunities may be surveys, some may involve clinical research, and others may focus on specific HHT symptoms, treatments, experiences, or just general quality of life. Not every opportunity will be the right fit for every person, and that's totally okay. Staying connected means you'll know you'll know when something comes up that may be relevant to you or your family or somebody you know. You can always share these opportunities with your healthcare provider as well so they stay in the loop as well. As many of you know, June is HHT Awareness Month, and this year is especially meaningful as Cure HHT marks its 35th year. We are raising every dollar going towards our Call to Cure campaign, our comprehensive campaign. We're looking to close out that final $1 million mark, bringing us that much closer to a cure. This month until June 30th, every dollar you give is matched. So if you haven't made your donation this year because you were waiting for a matched opportunity, it's here. The support that you give helps fuel work that so many families rely on: education, resources, advocacy, research, investment, and programs just like the Center of Excellence Network we're talking about today. Again, the match ends June 30th. So take 60 seconds and either give or share our campaign. Details can be found at curehht.org/awareness. We also have very fun events coming up. HHT Awareness Month is not just about fundraising. On Tuesday, June 23rd, we'll be hosting another webinar that is free access. It's a state of HHT, an update from Cure HHT's CEO featuring Marianne Clancy. That session will give a broader community look at where Cure HHT is today and what lies ahead. June 25th, YouTuber and Twitch streamer Console Kato will be hosting her second Cozy Games for a Cure, a charity gaming stream supporting Cure HHT. This is a lighter, community-centered way to raise awareness and supporting the mission while playing games with a great group of people around the world. I attended last year. It was very fun just to pop in and see what was going on. Would invite you to do the same. We're also proud to highlight the Diagonal HHT Patient Forum, which is an opportunity for patients, caregivers, clinicians, and researchers, as well as their families, a chance to come together for education, connection, and conversations during HHT Awareness Month at the Diagonal Therapeutics headquarters outside of Boston. If you're in the area, I definitely recommend it. It's free, and they'll be giving tours of their labs, research facility and laboratory. You can find all of these details and more at curehht.org/events. Finally, some important notes. There is a Q&A module in Zoom to submit your questions to the speaker. We'll get to as many as time allows. However, if you submit a question and it isn't answered during the live portion of today's Q&A, we do follow up with our community engagement team after the fact and answer those questions. So make sure it goes in the module. Today's topic focus for questions will be the Center of Excellence program. Please be sure to make your questions general in nature so they benefit everyone. Feel free to use the chat to interact with either Cure HHT staff or others attending the session. And then, as an important reminder, today's recording is being recorded and will be shared on demand afterwards. And finally, I'm happy to share our guest, Tania Competiello. Take it away.
Thank you, Val. My name is Tania Competiello. As Val mentioned, I'm the Senior Director for the National Healthcare Programs here at Cure HHT, and I'm very excited to share with you today some of our updates for our growing and expanding COE network, not only in the US and Canada, but also internationally. And of course, what does this all mean for you, our patient and community HHT throughout the world? So without further ado, I will get started. And making sure technology is working with us here. Now, I've highlighted some topics, so a total of 6 topics I'd like to review with you and give you a very high-level overview of what we've been up to over the past couple of years, some of the recent advancements, and of course, some of the recent announcements you may have seen through our press releases. So I'll be sure to touch upon all of these as we go through the presentation. First and foremost, we will be going into a COE network recap and what we've accomplished.
Tanya. If you're sharing your screen, I cannot see it.
I am sharing. Okay, let's stop sharing, start it again. Perhaps it was a glitch. Okay, how
Perfect.
is that? Perfect.
Yep.
Okay, perfect. All right. So now you can see the six topics I was talking about. We'll be going into COE network program recap and what have we done over the past few years, as well as the new 2026 recently launched criteria, and a little bit into the reasoning why we updated and why did we do what we did now. The COE processes, what does that look like now for a new center who is interested in becoming accredited? International announcements. We'll go into two recent announcements that we've recently announced to the community, far and wide. The Regional Affiliate Center pilot is a template and a model that we're constantly piloting. And if successful, we plan to expand that throughout the network. So I will go into a little bit more detail on that. And last but not least, what does this all mean for you as the HHT community as you go through it as a patient, a caregiver, a clinician, a physician, anybody in the community? When we wrap this all together at the end of the day, what does it mean? So without further ado, let's dive right into the recent COE network program highlights and what that means. As you can see here on the screen, we have, since the past 3 years, we have enrolled over 1,000 patients in our course registry. We have taught and enhanced and trained professionals, over 230 of them. We have 28 active centers of excellence in the US alone, and we have 50 plus global COEs worldwide. A very brief summary of all the great things that we've done. I couldn't fit them all in pages if I had them, but we'll highlight some of the major ones here are the course study that was published in the prestigious Blood Journal in spring of 2026, excuse me. It was the first ever of its kind publication from Cure HHT in our centers of excellence, and it was pulled from the course registry. And because of it, it's going to help us shape the future HHT strategies. The new 2026 criteria, as I mentioned, was launched with new requirements. We'll go into a little bit more detail in a little bit on that. We have exceeded all the HRSA program objectives for grant years 2022 through 2024. We have a Cure HHT National Patient Physician Conference in Dallas that took place last November that was very successful. We're looking to do more of those in the coming months and years. We also had a first ever very successful presence and booth at the International Hematology Conference in 2025 in Florida. And we have legislative advocacy has secured bipartisan congressional support for HHT Center program. Again, a big milestone, the first of its kind, where we've been able to actually secure bipartisan congressional support. Last but not least, we are working on, I should say, the HRSA grant application that just opened to us last week. We are hurriedly and all hands on deck trying to provide everything that HRSA is looking for us to submit our formal application. Once that goes through the process, we will be awarded funds, and then we will be able to assess, review all centers of excellence that will be applying for funding in fall of 2026. Now, you may be asking, why did we update the criteria? We had criteria before. Well, first and foremost, the last major update was in 2017, almost a decade ago. Since then, I am sure most of you know, if not all of you, that our network has grown, our science has advanced, and our patients deserve a stronger, more consistent standard of care. That was the main reason we looked at the criteria and took months to kind of reevaluate and see where it needed to be at today. This update reflects years of real-world experience, feedback from our centers. It relates to the latest international HHT guidelines and also takes into account real-life patient experiences and feedback. So if we have to think about what were the top pillars for updating the criteria, there are 5. One was to align with the most recent guidelines. 2, to strengthen our consistency across all of our centers. 3, to provide clarity to center leadership. 4, to elevate research, education, and advocacy standards. And 5, to ensure sustainability and accountability across all of our centers. What exactly changed in the 2026 criteria? Well, we took a look at core team members, and we know that they are essential, they are required, and they are foundational for a successful center of excellence. That team is made up of a medical director, a coordinator, a geneticist or a genetic counselor, a hematologist, intervention radiologist, and a pediatric specialist. In addition, we looked at doing additional updates to strengthen our standards for all centers. And that means that other specialties remain part of the team, and they must ensure that access and support is there for the core team. We established mandatory research engagement benchmarks. We further defined advocacy responsibilities for our centers, and we explained the mandatory participation in courses, education, and events. So all of our centers are educated, participating, and contributing back to the community. Now, this is a very high-level snapshot into what does it entail when applying to become a center of excellence. We have now a new simplified process for institutions who are interested in getting that accreditation, and it involves 5 major steps. The first is to submit an interest form, and this is a streamlined process where new institutions will be able to apply online and submit a short form after they review the new updated 2026 criteria to really see if they are ready to become a center. And that is how we internally also assess them to make sure that they have met the criteria or will be meeting the criteria by the time they formally apply. Number 2 is an internal review and assessment and comparing that back to the criteria. If the committee that we have in place, the executive committee, feels that the center is ready to go forward, then they are formally invited to submit a lengthier application that involves history and credentials for all team members, including the core team and the additional staff members, as well as the facilities, to find out what is available on site, what referral pathways they have, and so on. If that is reviewed, assessed, and approved, then we go on to a site visit, which is done in person, involves members of our committee who are center directors, as well as staff from Cure HHT. And that is when we actually take a walkthrough of the facility. We meet with the core team and we assess if they have everything in place that is necessary to truly become a center of excellence and be added to our network. And last but not least, they receive COE designation, and that involves formal announcements through press releases, sometimes local events, through the news channels, whatever form we have available to us, and of course, informing you, the community, as well. So that is what the process looks like now going forward. The renewal process, so we just reviewed the new certification process when a center wants to become a center, and existing centers also have to now go through a renewal process. That means our 32 existing centers of excellence, 28 in the US, 4 in Canada, will be going through a new standardized renewal process under this new stringent 2026 criteria. And that is to ensure that every center of excellence continues to meet the highest of standards. And that involves 4 major kind of processes to go through. So there is a full team review. So every center conducts an internal review led by the medical director. So all of our existing centers were given the new criteria already, and they've had time to review and assess their current state and also assess what they need to do, if needed, to improve to make sure that they're meeting these new standards. Next comes a site visit requirement, whether it's done virtually or live. certain criteria, such as a change in somebody in the core team member. So a member of the faculty that is listed as a core team member, if that changes, that requires us to go see that center live to ensure that consistency and the criteria is still being met. Otherwise, if they have exceeded prior and continue to exceed and meet the requirements, it may be done via a virtual visit. There's also a 12-month phased window. Now, because we launched the criteria, does not mean that we expect all centers of excellence to be practicing to the highest standards at 100% of the new criteria. They were to the old criteria, but that means that they have 12 months to get them to where they need to be with our assistance, with our templates, our processes, and check-ins and things of that nature. We're not looking to leave any center behind. We want every center to be successful that exists today and to become even more successful by meeting the new criteria. And last but not least, there will be a new online platform launching this summer that will make this entire process easier, not only for renewing centers, but also for new interested centers, where everything, all forms, applications, and requirements and documents that are required will be done online. So none of it will have to be done by phone and by paper trail and all of that like we used to in the older days. So more on that information will be coming to them as well soon. And we'll be offering training to those centers to ensure that everybody knows how to use this new online platform. Now, we mentioned some new exciting announcements as it relates to our new International Centers of Excellence and their designation. There was a press release in May, just recently, for Leuven, Belgium, one of Europe's leading academic medical centers, who has achieved Cure HHT Center of Excellence designation. This means that they are now bringing world-class HHT expertise to patients not only across Belgium, but also across the wider European region. This center offers comprehensive multidisciplinary team covering all specialties. It serves patients, as I mentioned, across Belgium and other surrounding European countries. It continues to add on and grow and build our international COE network. It expands access to expert HHT care for the HHT European community. And it continues to help us advance international research, collaboration, and data sharing. And a quote from the new medical director there at the site is one that states that this designation reflects the outstanding dedication of his team working together to provide a highly specialized, patient-centered care for individuals and families affected by HHT. We're very proud to have partnered with them and look forward to continued success and to support them throughout the years to come. And just even more recently, we had a formal press announcement just this month in June for the new HHT designation for the Alderheyes Children's Hospital in Liverpool, United Kingdom, who has also been officially recognized as a Cure HHT Center of Excellence. And most importantly, is the only pediatric-focused HHT center in the UK, first of its kind. So we are very excited to be partnering with them and also working with them. This team in the UK also has a multidisciplinary team in place that includes genetics, pediatric ENT, hematology, cardiology, neurosurgery, and more. It is currently accepting new patients, and it is welcome inquiries from families and also referring providers. And it has now been added to our growing global network of more than 50 Cure HHT Centers of Excellence worldwide. And in typical fashion, the new medical director had a quote to share as well too. And he went on to state that this is a statement, a testament that is dedicated to the care and the interdisciplinary approach our colleagues provide to children, young people, and families affected by HHT. So we are very proud to have partnered with the center in Liverpool and also look forward to working with them together for years to come. As you can tell by these new recent announcements, we do have a growing global network of HHT expertise. As it stands today, we have 50 plus centers worldwide. We have 32 centers in the US and Canada. We have just recently added the new centers in Belgium and the UK. And we have extended the portal for submissions for new centers who may be interested in, from which 5 will be invited to continue on the application process. So as you can see, we'll be adding on to that 32 number and continue to add growing institutions. From a high level, what does that network expansion timeline look like? I mentioned that in March, we launched the new criteria to all of our centers. In April, the new interest form process opened for the US and Canada and will be closing at the end of this month. And that is a process that we will go through, review interested centers, assess with the committee, and invite 5 to continue on through the process and formally apply. In May, there was the announcement for the new Belgium Center. June, the new announcement for the Liverpool Center. And in fall, winter 2026, a new regional affiliate center pilot, which I will go into a little bit more detail. And next year, fiscal year, new institutions will be on path to be certified, US and Canada. So those 5 that will be chosen to continue the process will then receive certification if all goes well next year. The process takes about 12 to 16 months. Also, next year, we'll be looking at the international COE inspection planning and looking to see where we may work and partner with new centers internationally. And in the following year, we plan to look at pediatrics and go through the same exercise that we just did end of last year through this year for our US and Canadian centers. So as you can see, it is a phased approach where we're looking at US and Canada first. We'll look at international next, and then we'll follow with pediatrics to ensure that we are doing the same process, the same due diligence, looking at criteria, looking at all the forms, site visits, and everything that goes along with the process to ensure that there is success and sustainability for growth within our network. Now, I mentioned a little bit about the new regional affiliate center pilot. Of course, I can't yet share names or locations, but it is one of the most exciting new initiatives. And it is a model that is designed to bring HHT expertise closer to patients who live far away from a full COE. It is meant to alleviate the burden of having to travel hours and miles on end to the nearest center of excellence. We are piloting that now with a center as well as an assigned mentor center. So this regional affiliate would be working in a partnership with a well-established center of excellence of ours so they can learn and grow from them. And what this model means is that you will have closer to home access to HHT care. You will have a streamlined referral pathway to a full center of excellence. If there was something that was needed beyond the care that you were receiving at a regional center, they will be able to accelerate the referral pathway to have you being seen at a full center of excellence that they have a mentorship with. There would be visibility into upcoming clinical trials and research opportunities. There would be a formal Cure HHT designation for this regional center, as well as collaboration with other center directors and specialists, and of course, patient education tools and resources provided. We are forecasting this first pilot to be ready to be launched in the fall of this year. And if successful, we are looking to replicate that model into other areas within the US that currently have a big gap in geographic area between centers of excellence to ensure that we are offering the care to patients who need it closer to home. This is a great snapshot that was pulled right from our website that shows on a big grand scheme of things the international HHT treatment centers as they exist today. So you can see international representation here on the international side. And on the US and Canadian side, you can see the representation as well by looking at the pinpoints there on the map as indicated in red. And one exciting feature from this is that on our website, we recently upgraded, and if you click on any of these red pins, it automatically comes up and shows the center name and address, and you can hover over any of these pins in the map, and the same would take place. And as a reminder as well, too, please do utilize our website at www.curehht.org for things like finding the nearest treatment center to you, for patient resources, downloads, and any other information related to centers, research, and beyond. Now, I know I spoke a lot, I shared a lot of information with you, and this was just a small piece of everything that we have been working on and continue to work on and will continue to work on. But at the end of the day, what does this all mean for you as an HHT patient? First and foremost, growing the network, launching this new criteria, setting the high standards and the same standards for all of our centers means that you will always know what to expect, regardless of which center you go to. Every center must meet the same high standards, so you get consistent expert treatment regardless of where you go. It means that you will have access to the right specialists. It means that having a well-defined core team, as I mentioned, the medical director, the geneticist, the hematologist, and others in that core team means you have the right experts as part of your care. And that means from diagnosis through ongoing management. It also means that your center is built to last. We want centers to last. New accountability requirements means that your center is sustainable for the long term. They're not just here for a few years. We're looking for continuity and satisfaction, as well as success for years to come. It also means that you're part of a growing global network, new international centers of excellence, and a regional affiliate model means that more patients, not only in the US and Canada, but worldwide, will have access to HHT expertise than ever before. And last, but certainly not least, your voice still matters. Advocacy is a responsibility of every center. Centers are now more than ever accountable, not just to science, but also to the community that they serve, to each and every one of you. And I will leave you with this thought as I end the presentation that together we are changing the future of HHT. We couldn't do it without you. Thank you.
Thank you so much, Tanya. I think there's a lot of really great information in the webinar, as well as a lot of changes hopefully coming down the pipeline. We did get quite a few questions ahead of the webinar, so as we give time for people to submit their questions to the Q&A box, I'd love to start with some of those if that's okay.
Yeah, absolutely. Let's do it.
First and foremost, will my COE lose its designation during this process?
Good question. No. If it is an existing center, we are assessing all centers currently, and we are allowing everyone a 12-month rolling period where they do have the opportunity to look at areas that perhaps were not mentioned in the previous criteria, but are now in the new criteria. And with our help and our support, we will support them through the transition. Our goal is not to get rid of centers, but to add centers and keep the existing ones.
And what does it mean, like, if a COE can't meet the criteria of the new program?
That would definitely have to be on a case-by-case basis, right? We would have to evaluate, meet, go out there, kind of assess the situation. But as it stands today, there should be no reason why they should not. The criteria was written in a way to allow centers to be able to adapt and adjust and grow with the criteria, and not to simply say, we're not meeting that today, so therefore we can no longer be a center. That is not the way the criteria is written.
Okay. And then I think as we have the Q&A, if you don't mind pulling down the presentation just so that people can see
Yeah, of course.
the two of us here. Um, I know one of the more exciting parts of the criteria is that there's mandatory research engagement. Can you talk a little bit about what that looks like for COEs?
Yes, absolutely. So we've had wonderful opportunities so far, and we'll continue to have more opportunities to involve our centers of excellence in letting them know what clinical trials are up and coming, and having our centers kind of explain and share those opportunities with our patients is really where we're going to see research grow. So we want our centers to be involved and to inform patients, to let them know of clinical trials and participants that they are looking to enroll. We need that obviously to continue with clinical trials of all the exciting things that you've heard, of all the new treatments and drugs and kind of things that are being worked on as we speak. But having our centers knowing about it, being knowledgeable, and then sharing that information with you, the community, is really what's going to make it successful. So any new development in research, any new clinical trial is shared with our centers of excellence. So they hear from me very often when it comes to that.
On quite a few of those CCs, so I know that they're getting reached out to quite frequently. We did have a comment come through in the Q&A box. Do centers outside of the US and Canada currently need to go through a COE renewal process, and will that change?
Currently not. So that'll be part two of the phase. Yes. So currently it is just US and Canada.
Okay. Um, do we have any more questions from our community currently watching? This webinar, as a reminder, will be available on demand. Those who pre-registered for our webinar will receive it ahead of its public availability. But Tania and her team are also here all year round to answer questions about the
Yes,
Center of Excellence program.
absolutely. And I'm sure some questions will come to mind after the fact. So please feel free to always reach out with any question, concern. We'd be happy to connect.
I do have one. When may we see more about the regional affiliate opportunity? Is that 2027 or still to be determined?
Great question. Since we are piloting the new location for the pilot, we expect fall of this year. If it all goes according to plan, we are looking to duplicate that and open it beginning of next year to other locations. So soon, next year will be here before you know it.
No problem. Any additional questions? Okay. Tania, thank you so much for your time today. We'll close the webinar a little early. If you have any questions, feel free to reach out to Tania or to the Cure HHT team at hhtinfo@curehht.org. Please make sure to follow us on social media. You can also reach us through our private DMs at all times. Our community engagement specialists or our marketing team will also reach out and direct your questions where needed. And be sure to subscribe to our email communications through any of the opt-in forms on our website. That's where you're going to get the most efficient and timely requests for new information, research opportunities, events, and happenings for Cure HHT or the HHT community globally. Thank you so much. Have a great day and enjoy HHT Awareness Month. Bye.
Thank you, everyone. Bye-bye.